Everybody, and thank you for joining us for this program, Practical Advice for Curbing the Work-Life Conflict Crisis in Your Firm. I'm Bree Buchanan, and I am the board president of the Institute for Wellbeing in Law, which we like to call IWIL. And this program today is sponsored by the Professional Development Consortium. So many thanks to the PDC for supporting our work. I bet a good number of you know about a new lawyer study that was published just last week. So this program couldn't be more better timed. It's a study by Dr. Justin Anker and somebody you may know, Patrick Krill. This is a study that was conducted last summer. So we're in the midst of the pandemic. And it was of 3,000 practicing lawyers in California and DC. And the findings were troubling, particularly as it pertains to women in the profession. They found that 1 in 4 women are contemplating leaving the profession due to mental health problems like depression or anxiety, to burnout or stress. And they also found that for women who are experiencing a high work-life conflict, they were 4.5 times more likely to be planning to leave the profession. So we are so fortunate today to have a leading expert, Dr. Leslie Hammer, who's going to talk to us about some science-based strategies for dealing with this issue. Our after-party organizer, Ann Bradford, told me she thinks of Dr. Hammer as one of her research heroes. So Dr. Hammer, I can't wait to hear what you have to say. And so everybody knows this is the kind of programming that the Institute is going to be bringing regularly. And so we want to make sure that you are up to date on all that we have to offer. So I encourage you to go to our website, lawyerwellbeing.net, to sign up for regular notices about what we're doing. So at this point, I'm going to turn it over to Jean Picht to introduce Dr. Hammer.
Thank you, Bree. Yes, I'm Jean Picht, the Director of Professional Development in Fried Frank, and I was lucky enough to work with Anne and her planning team on pulling this week together. So I am delighted to be here to introduce Dr. Leslie Hammer. She's a professor in the Oregon Institute of Occupational Health Sciences and Oregon Health and Science University. She is a co-director of the Oregon Healthy Workforce Center and one of 6 total worker health centers of excellence funded by the National Institute for Occupation Safety and Health. Now, she's a leading expert on the health effects of supportive supervision and work, and on the health consequences of work-family conflict, of which we can agree there are many right now. She has extensive experience in designing, implementing, and evaluating supervisor training. Her research focuses on ways in which organizations can help reduce work and family stress and improve positive spillover into non-work life. And meeting my cat Harry here, he always comes at just the right time. Positive spillover into network, non-work life, and facilitating both formal and informal workplace supports. I turn it over to you, Dr. Hammer.
Thank you, Jean. I love Harry. I have a Paul who is locked out of the room right now, so we won't be seeing Paul. But hello, everyone, and it's a pleasure to take part in this after party. Thank you, Bree. Thank you, Jean, and Anne. Thank you so much for inviting me to the after party. I love parties and I love after parties. And what I love most is really sharing information that I have accumulated over the past 30 years of my professional career in really understanding how workplaces can better support employees around health and well-being. And it's what I'm going to be basically focusing on today is providing information to those of you who are well-being coordinators, policymakers in law firms you're learning and you're understanding and you're implementing practices that are effectively focusing on well-being and health of employees in law firms. And so it's my pleasure to take part in this after party, and I'm going to share with you some of my learnings and development of trainings around really dealing with work-life conflict. And as Jean stated, I am a professor in Oregon Institute of Occupational Health Sciences at Oregon Health and Science University. I'm the co-director of the Oregon Healthy Workforce Center. And the Oregon Healthy Workforce Center is one of 6 centers of excellence funded by the National Institute for Occupational Safety and Health. And it's a center of excellence in total worker health. Total worker health specifically has to do with really identifying policies and programs in workplaces to better support the health, safety, and well-being of employees. And my background is industrial and organizational psychology. So I've been trained as an industrial organizational psychology, and I understand the workplace. And that has, as I stated, that's been my focus for the past 30 years, is really understanding how the structures and systems at work impact health and well-being and safety of people at work. And there's a lot that we know about, and there's a lot that I have studied that I'm going to share with you, but we do have an ability to really change the workplace to better support workers around health and well-being. And as Bree stated, and I'll actually allude to as well, specifically in the law industry, there are significant concerns around work-life stress, burnout, drinking, and ways that may impact not only work, but also non-work. So taking a total worker health lens is important because it really considers not just the importance of individual well-being, which we know individuals can do things to improve their well-being. And you've been learning about those, and those of you who took part in the first part of the Wellbeing Institute, really Wellbeing and Law Institute, learned a lot about kind of individual well-being strategies. But those strategies are only so effective, and it's important to integrate those strategies with kind of organizational level strategies or the root causes of occupational stress at work. Stress itself is really due to the kind of conflicting, the difficulty in combining 2 opposing forces. And when we talk about occupational stress, it really has to do with roles and the different roles that we are engaging in at work. Job stress has to do with the stress that we're experiencing and the emotional responses that we're experiencing when the requirements of our job are too much, when they really press us in terms of our relationships, our capabilities, and the demands. We experience stress. So some key stressors that impact job stress specifically are low control. So low control over work. And if you think about low control, that is your ability to make decisions at work. And sometimes in some roles, people have greater ability to make decisions and decide what they're doing, or make decisions about where, when, how they are engaging in work. When that control is low, our stress is higher. Not surprisingly, low pay is also a source of stress, and uncertainty. And I can imagine that especially in the law industry, there's quite a bit of uncertainty, ambiguity that comes with roles and engaging in work from time to time. And that uncertainty, ambiguity, sometimes we can't do anything about, but we do need to realize that when there is uncertainty, ambiguity, when we are not really clear about how to actually do the job, because there's many different ways of doing it, that creates stress. One way of addressing that stress is to increase social support, because when social support is low, that also contributes to stress. And that's what I'm going to key in on as I talk about strategies. Negative social interactions, job insecurity, bad work schedules, poor treatment. These are all examples of workplace factors that impact job stress. And they are things that we can actually have control over if as well-being leaders, as leaders in workplaces, we can impact some of these to reduce the job stress. And as Bree mentioned, there was a recent study based on ABA sponsored study. And this study was striking in terms of a lot of things for me. I study all kinds of workplaces. I spend most of my career in workplaces, not in my lab. I'm in workplaces. I've studied grocery workers, I've studied IT workers, I've studied healthcare workers, I've studied construction workers, many, many different types of workers, but actually personally have not studied lawyers. And these findings are striking, and we need to be paying attention to the reality, which is high levels of work-family conflict for any worker is difficult, and it does lead to intentions to leave or actually leaving the job. And the findings of this particular study showed a significant relationship between high levels of work-family conflict and indications that people were thinking of leaving their jobs, and specifically women. And furthermore, this was further emphasized with women reporting higher levels of mental health problems, burnout, stress, alcohol use. So while work-life conflict is an issue that is important to women and men, we tend to see time after time again that women do tend to be hit with the responsibilities of family, or take on the responsibilities of family more so than men. So this work-life stress that people are experiencing, we specifically focus on work-life stress as an aspect of job stress. It is one of the most significant aspects of job stress. The American Psychological Association does an annual survey called the Stress in America survey. And it's really a national level survey. And time again, work-life stress is one of the top stressors reported by individuals. And so as a professional, I have really dedicated my career to understanding ways of reducing work-life stress. And I talk about work-life stress as an occupational hazard. It's an occupational hazard similar to high job demands, which include high number of hours worked, or occupational hazards similar to physical hazards in the workplace. Because work-life stress impacts not only an individual's psychological makeup and experiences, but it impacts individual health. And it also spills over and impacts families and in turn communities. So causes of work-life stress are similar to the causes of job stress. And so when we talk about actual practical things that we can do at work to reduce work-life stress, we can focus in on social support, on increasing control, on reducing job demands. And as I said, work-life stress, work-family stress impacts us at home, it impacts us at work, and it impacts us physically in terms of our health. And what you see here are all evidence-based outcomes that have been shown to be resulting from high levels of work-family stress. So as a workplace, we need to be paying attention, not only because it impacts work, but because it impacts our workers, their family members, and their health. So organizations have tried to tackle this problem of work-life stress in many different ways. Now with COVID, I mean, we see also, I mean, it's so interesting to see how many workplaces that refuse to provide flexible work schedules in the past have just had to be thrown into remote work. And guess what? It did not have a negative effect as many employers, leaders were expecting and thought when people work at home, when people work remotely. So remote work and flexible work schedules is one way that we've tried to deal with work-family stress. However, also during COVID, we have parents who are working out of their homes, who are teaching their children or taking care of their young children. And it is an additional extreme stress. And I have talked frequently over the past year about how parents have been expected not to miss a beat. So even though our kids were not able to go to school for the past year and had to be learning out of the household, those with young children had to be highly engaged with those kids and yet still maintain their jobs and their same work schedules. So it's been a very challenging year, as we know. As I talked about earlier, well-being programs, specifically focusing on individual well-being, is helpful and important. Learning about healthy eating and providing exercise programs, providing in-house gyms, all of those types of well-being programs are really important to individuals, but they're just one piece of the puzzle. It's not everything. We can't solve everything by telling the individual employees to, okay, do X, Y, and Z. As workplaces, what I have been focusing on are some of the other strategies that need to be implemented from the organizational leadership perspective to help improve well-being of workers. So what can workplaces do in addition to different work arrangements, different flexibility policies? As I said, there are ways of reducing occupational stress. Workplaces can reduce the demands. There's also recent research on the excessive health outcomes associated with high numbers of hours of work. And in law, that clearly is an issue. The hours of work in a week are much higher compared to other industries. That's a job demand. If we can reduce those job demands, we can improve health and reduce stress of workers. And as I mentioned, increasing control, pay, social support. So what I do is I focus in on social support because in my career, I have learned as a work-life scholar for 30 years, I have learned that supervisor and leader support has been incredibly important to helping improve individuals' reports of physical and psychological well-being. However, early in my career, when I was studying these issues around leadership support, I realized, well, there's no real prescription for how do workplaces actually do this? What can workplaces do? And so I decided that with my colleague, Dr. Ellen Kosick, we together decided to actually develop training for supervisors and really understand what are the specific behaviors that supervisors should be engaging in. And this is because workplaces have really not been focused on support. So people managers are the linchpins. People managers are critical to impacting so many work outcomes. Successful workplaces have successful people managers. And workplaces need some help in understanding how to develop those people managers in terms of training them to better understand how they can provide this support. So as I said, there was lots of evidence, correlational evidence showing that, well, if somebody reported that they were doing well emotionally, physically at work, they also reported that they had a supportive supervisor. But there was nothing out there 15 years ago to tell supervisors, what does it mean? How do you engage in supportive behaviors? And what we found, my colleague, Dr. Ellen Kosick and I found, is that supervisors actually thought that, and think, even today, they think that they're doing such a great job. But when we ask their employees, no. I find this time and time again, that when we ask supervisors how supportive they are, they rate themselves much more supportive than employees do. Their employees say, well, not so much. And that's a problem. We call that a perceptual gap. And so our goal is trying to really close that perceptual gap. So our research shows that employees' ability to align their work and personal lives really does hinge on what the manager, the leader, is able to do in terms of some specific strategies. And as I said, I started studying these issues with Dr. Kosick, and then we've identified these strategies, and then you'll see I'm going to talk about how we've actually expanded them and modified them and studied them in different types of workplaces and focused on different types of support. So there's lots of ways that I've learned that leaders can support their employees. And when managers and leaders do this consistently, we see positive outcomes. See positive outcomes in terms of employee engagement, retention, well-being. And before I go, I want to encourage people, please, if you have questions, enter them into the chat, because I'm going to have time. I'm going to have plenty of time at the end of my talk. I'm not going to be using the full hour, and I want to be able to engage in some Q&A with you. So please enter your questions into the chat, and I will address those questions at the end. So please feel free. So now I'm going to move on and talk about what is this? What are these strategies? These strategies are based on research, but they're based on research in workplaces. So I have been fortunate enough to have significant funding in terms of grant funding to be able to actually systematically evaluate the effects of training leaders on how to be supportive using these specific strategies that I'm going to talk about, and evaluating them in every single one of these using a rigorous research process where I've been able to go into workplaces and actually administer the training to one group of leaders and not to another group of leaders, and then be able to statistically look at the difference between the effectiveness of those groups. And when we find that the employees of the leaders who were trained do better in terms of health and safety and well-being outcomes than the employees of the leaders who are not trained, we have evidence there, and that's causal evidence. It's different than relationship correlational evidence from one time period. This is actually causal evidence. And it's really important to understand that these strategies are evidence-based leadership trainings, and these outcomes are effective. So as I said, I first started with Dr. Kosick, and this was actually back in 2005. And we were funded by the National Institute of Health as part of a large multi-state program called the Work, Family, and Health Network. And we developed the Family Supportive Supervisor Behavior Training and the FSSB. And that was sort of the basis for everything that followed. And then time after time, I expanded those concepts and studied them in workplaces and in military settings, and further validated the effectiveness of these strategies. And so now I'm going to move on and talk more about what those strategies are. So again, they're based on the Family Supportive Supervisor Training. That was the basis. And since then, I have conducted research both in the military and outside of the military, funded by the NIH, the National Institute for Occupational Safety and Health, and the Department of Defense, where each time we've trained leaders and then studied the effects on their employees. And that training of leaders is not rocket science. And this is what's so interesting, is that leaders, some of them know this already, absolutely, but a lot of them don't. And it's just training them on people skills. These are just people skills, how to connect with individuals, training them on communication, training them on how to work better with their teams, training them how to provide social support. And these core family supportive supervisor behaviors are the key. And these have been elaborated on each time. And so I'm going to define these. So in terms of these core family supportive supervisor behaviors, 4 core behaviors. The first one is training supervisors on providing emotional support. And some of you as well-being leaders, as policymakers in law firms may think, well, I already, I know how to do this, and I know most of my people know how to do this. But if you actually go and start talking to people, and I bet many lawyers and many leaders in law firms, they may not really understand the critical importance of emotional support, of just the face-to-face contact, just checking in with people and asking how they're doing, communicating general concern, genuine concern and general concern, communicating concern for work-life issues, paying attention to how people are doing, checking in if somebody does not seem that they're on their game. Instrumental support is another type of behavior. And this really has to do more with really understanding the resources that are available to employees and being able to provide those resources. I had a colleague, gosh, this was 20 years ago. I had a colleague who was, and this is when I was in the psychology department at a university, at Portland State University. And one of my colleagues was dealing with an aging parent. And she was so upset because her mother was, I'm in Portland, we're in Portland, her mother was in Houston, and she was not sure of what she could do to help support her mother as her mother was declining in health. And I suggested to her, well, don't you know about the Family and Medical Leave Act? Okay, this was probably 20 years ago, so probably the FMLA was just around for about 7 years. And she knew about it, but she didn't understand her rights. And so just explaining her rights around FMLA, explaining the importance of her really taking a break from work was sufficient and effective for her to actually take time off, take a leave of absence, and go take care of her mother. And it saved her, well, it saved her emotionally. So instrumental support is really the importance of managers and leaders really knowing about all the resources that they have at their fingertips. so that they can share those with employees. Work-family role modeling. That's also a kind of core behavior. And if leaders are not exhibiting and not showing and not modeling effective work-life balance, others will not either. So leaders do have a responsibility of supporting and showing and demonstrating that they are taking care of their own work-life balance in ways. And that may involve sharing when they're taking a vacation, they're going to go on vacation with their family, they're going to take a break, sharing that, you know what, I'm not going to work until 9 o'clock tonight. I'm going to leave at 3 and go and watch my kids' baseball game. Talking about how they are taking care of their own work-life issues and modeling that. And then finally, creative work-family management. I mean, this really has to do with the fact that there are ways in workplaces, and this is unique to each workplace and probably unique to each law firm, how people can work together effectively, cover for one another, and some may need to reduce time, some can pick up on time, but there is a way of creatively working as a team to effectively support work-life balance. And again, these strategies are going to be unique to each firm and each team. So remember, I said we studied these effects. Okay, we studied these effects. The FSSB, initial FSSB was studied in grocery store workers, and then we studied in a huge IT firm. So we studied in hourly workers and in salaried workers, in work that was really place-bound, work that was not place-bound. We also studied in healthcare, and what we consistently found were positive effects. When we trained leaders, we studied the effects on their employees. And when we trained leaders, and this is really important, because this is you actually intervene with one group of people and then you see the impact on others. So it transfers over. When we train our leaders, we can actually measure the effects on their employees. And we found really important outcomes: decreased intentions to leave, okay, decreased turnover, improved reports of physical health, improved sleep. We also found effects on family members, improvement in time with children, parental time with children, improvement in kids' sleep time. So this was not just the effects of the leader training on their employees, but also we actually found in these randomized controlled trials, that means this is, again, causal. We were able to really isolate these causal effects, that when we train leaders, we actually saw benefits in family members. So that was enough for me to say, I'm going to expand this. I'm going to do more with this. And I then developed further trainings using these concepts of family supportive supervisor behavior training, and expanded it to something called the Safety and Health Improvement Program. And this elaborated, here we have a 1-hour computer-based training, followed by behavior tracking. Is tracking. So when we trained the leaders on those behaviors, and we expanded them then to include safety communication, because this was actually in a construction setting. It was sort of construction. They were field workers with the city of Portland in the Water Bureau and Portland Bureau of Transportation. So we gave them a 1-hour computer-based training. That's it. This is not like 2 weeks of training. This was a 1-hour computer-based training, followed by having them transfer the training, what they learned in the computer-based training, to on-the-job behaviors. So they tracked their behaviors, their supportive behaviors, over the course of 2 weeks. And they also had some team sessions that helped them talk about how to improve processes in the team. And I'm actually going to give you resources where you can actually access these this particular training program, which is now more generalizable. While we developed it for construction, we now have a general version that any workplace can use, and you can access it yourself, and I'll give you the links. And we found when we implemented the Safety and Health Improvement Program that, again, we saw improvements in well-being outcomes, and we saw improvements in health, and specifically we saw blood pressure reductions. So again, here we are training the leaders, and we see these outcomes in their employees. And again, this is using a randomized control design, which means that we had one group trained, another group not trained, and we evaluated the effectiveness. Then extended the concepts into the military. This was the Military Employee Sleep and Health Study, where we then always had at the core family supportive supervisor behaviors, but we included further teaching leaders the importance of sleep and supporting sleep in their employees. And how do we support sleep in employees and reduce work-life stress together? And that involved teaching leaders the importance of sleep, teaching leaders about how let's pay attention to when somebody has been working shifts that through the night. We shouldn't have a meeting in the morning when they just went home, requiring them to come back, as an example. And this was a really neat study, because it involved not just training the leaders, but it also involved having individuals track their sleep. And individuals, we did this in collaboration with the Walter Reed Army Institute for Research, and they loaned us these very fancy actigraphy watches that we had employees, and they were full-time employees of the Oregon National Guard. They wore these watches, these actigraphy watches, which tracked their sleep-wake cycles for 3 weeks, and they wore them. And then we gave them feedback based on a complex algorithm. We gave them feedback on their sleep effectiveness. So in essence, they had this kind of organizational intervention of the leader support, and they also have an individual intervention of them getting sleep feedback. So this family supportive and sleep supportive supervisor training was multifaceted. It involved teaching the leaders about the importance of sleep, teaching them about specific behaviors around family support and sleep support, teaching them about sleep hygiene, and having the leaders' behavior track in concert with having their employees track their sleep and get feedback on their sleep. And what we're actually doing at this point is, while this was developed for the military, we are developing a civilian version, and we are going to eventually be testing this civilian version in a civilian workplace. And we'll have it available, also freely available on our through our websites. But what we found with the military version is that it improved their the reports of supervisor sleep leadership. So this was employees reporting that my supervisor is supporting my sleep, that my supervisor is doing a good job of supporting my sleep. We also found, actually as a corollary, we did another follow-up during COVID, and we found that when we trained them on this military employee sleep and health aspects, that those supervisors did better during COVID, that they were rated as better supervisors during COVID. So they did a better job during the pandemic. And that actually is, I think it's fascinating findings, and we're working on publishing a couple of papers based on that. So again, we're seeing these improvements in employees, both physical and psychological outcomes. So where can you find these, as I've been alluding to? Well, in my institute, we have something called, within the institute, as I mentioned, I'm part of the Oregon Healthy Workforce Center, which is this total worker health center of excellence. And we have tools and toolkits that we've developed. And this is because we have federal funding. When we develop tools and toolkits, they're available. We're making these available free of charge to workplaces. And while we are kind of, we're for OSHA purposes, we're Region 10. So we mostly do our outreach to Oregon, Washington, Alaska, and Idaho. But we also make our tools and toolkits available both nationally and internationally. So you could visit yourworkpath.com, which is where our tools and toolkits are housed. And you could have access to these trainings. And specifically, the training that was part of the Total Worker Health Center project was my Safety and Health Improvement Program. And that is available for access. What we do is we have it available on our website that employees, that leaders can go through, but we also offer and provide the source files if a workplace wants to load it into their own learning management system. We have several other programs that are available through yourworkpath.com. And we also have a number of different, what we call tools, but they're resources. They're lifestyle cards that people can, they're kind of complete their activities. There's resource directories. We have podcasts, and our podcasts are about monthly now, and they're podcasts with experts in the field. And we have safety and health impact guides. We also have blogs. We have weekly blogs. And I'll give you links to all of those at the end, and I'll leave them up as when we go through the Q&A. And again, these are all available for wellness coordinators to share with workplaces. We have COVID resources, and these were COVID, and again, these are developed by a workplace center. So they are focused on what workplaces can do around COVID. We developed a very brief, like 5-minute micro training focused on pandemic response for supervisors. That's available through our Your Work Path program and through our, actually through the link, wouldn't necessarily, it's not necessarily through the Your Work Path, it's through the link provided here through our Oregon Healthy Workforce Center. We have articles that we write, lay articles, in addition to the research articles. And one example is Lead with Empathy during COVID. And again, this is available at our COVID and the World of Work website. And then we have we're actually, Ellen Kostick and I are now teaming up with a firm who is working on developing our ideas and really reframing the FSSB, the Family Supportive Supervisor Behavior Training, in a broader program that is contextualized with webinars and train-the-trainer offerings. And it's called Work-Life Align, creating work-life alignment, and where people managers are the linchpins. And the website is worklifealigned.com, and it is just developing. So will be more available in the future. So here is my contact information, and I'm happy to correspond offline with anybody. Feel free to join our Facebook, Twitter, LinkedIn, any of our resources here. Our blogs, I have to really tout, we have exceptional blogs on kind of cutting edge issues on, as I said, about a weekly basis. And feel free to access any of this material. So at this point, I think I would like to, I'm very on time, aren't I? Okay.
Yes, you are.
I don't know if I have any questions though. Do we have questions?
You do. You
Okay,
definitely have
fantastic.
questions. So
Excellent.
First up, how can we teach empathy and emotional intelligence to lawyers, especially those higher up the ladder? And then someone added on to this question, just to make it really interesting, especially those higher up the ladder who insists that they did it the hard way, and that's part of being an associate.
Oh boy. Boy, it sounds like the medical profession. I mean, I had to, I work 24 hours a day, and so you do too. Some of this, I hate to say, it's gonna happen with time, because we do see generational differences. But that's not the answer you want. You want to know, how do we do this now? How do we do this now? We expose them. I mean, and what I do is I would expose them to the training, recommend that they go. I mean, these trainings are 1 hour. I mean, this is not a lot of time. And so if there is a way of encouraging and maybe even starting with some of the lay articles about the importance of this, of this emotional intelligence, this importance of this empathy. And I actually have that, there's an article specifically about empathy during COVID. They need to hear it over and over again, and they need to be provided with evidence-based information and tools. And so I strongly encourage you to take a look at some of the articles, the lay articles, because again, we as a academic, I sit here and write academic articles, and I know that they're not getting accessed by, leaders in law firms necessarily. That we need to write in a way that's translatable, that is clear and to the point. And so I think that some of these lay articles would be helpful. So that's what I would recommend. And it's just funneling the information their way.
Thank you for that. We do have other questions.
Right.
So can you talk about the extent to which the experience of conflict is subjective? So could two people working the same hours have a different subjective experience of conflict based on the supervisor's supportive behaviors?
What a great question. Such a psychological question. Yes, absolutely. So my experience of conflict may be very different of work-life conflict. I'm going to get in. I'm going to say it may be very different than say if I'm a team member and my coworker is a team member and we both have the same supervisor. Our experience of work-life conflict may be very different in terms of how we perceive our supervisor, leader. And it is so much dependent on everything. So it's dependent on our personal history. It's dependent on the successes that we've had at work in the past. It's dependent on our coworkers. And so it's dependent on our own personal family life. If my family life is falling apart and another person's family life is fine, maybe the treatment by a leader is going to affect me way more severely than it will affect another person. So yes, I mean, it's a psychological question that there is so much involved here, and we are complex human beings. And so we never can account for all of these factors. And what we do, and that's why we look at kind of trigger points. I look at kind of targeting, and that's why I focus on leaders, because I know that the supervisors can have an impact, but their impact, they can have the same behavior towards me and they can have the same behavior towards my coworker. But if I've got way more things going on at home than they do, our perceptions will be different. But what we do know is that the support overall will be helpful and beneficial. So we can't account for all the differences in our personal lives and our experiences and our history. But what we can do is we can teach our leaders how to be more supportive, so that overall across, and that's why we don't just study one person. That's why we have to, when we do research, we actually have to study many, many people, because we look at sort of what happens overall. What is the mean effect in a sense? So it's complex. It's a really great question, and it's complex. but there are many, our individual perceptions are impacted by so many things. But we do know that regardless of that variation, the leader's behavior can have an impact.
So I'm hearing that the leaders should go ahead and dive in and engage in these behaviors without necessarily overanalyzing or letting different reactions hold them back from doing that.
Yes, it's important to understand that overall, that those behaviors are effective, that they've been shown time and time again to have positive outcomes on health and well-being in across groups of employees and teams.
All right, one more here. The 1 hour computer-based training that you talked about for family support. Can you describe some of the topics that are covered within those?
So we start with sort of making the case. Why is this important? Because I mean, and it's similar to how I presented today. So you sort of start with, you know, what is the prevalence of work-family conflict? Why is this important? Well, and you know, discussing kind of the diversity of the workforce, the diversity of employees, and why family support is needed. What we know about the from prior research, what we know about relationships between work-family conflict and stress outcomes and workplace outcomes. And a lot of times for employers, a lot of it depends on the bottom line. And we show, yes, there are bottom line outcomes, bottom line effects. You know, you increase, I mean, when people have high levels of stress and work-family stress, they have higher health problems, higher levels of health complaints, higher levels of health problems, and that increases your healthcare costs. These are, so we make the case in terms of the importance to the workplace, the importance to the leader, how it improves leader effectiveness. And so we start, that sort of sets the context in the training, and then we go into training the specific behaviors. Those behaviors that I talked about, those 4 behaviors, those emotional, instrumental, role modeling, creative, work, family management. Sometimes they're called a little bit different things, but they are 4 core behaviors. We give examples. We have scenarios, you know, little kind of animations and examples and videos, depending on the particular training program. But this training involves sort of making the case, giving examples, and then talking about kind of the follow-up and what's important to actually implementing and tracking behaviors following the training to really improve the transfer of the training.
Okay, excellent. Now we have one comment here that was tied to a prior question. It says, for the more senior lawyers, I think it's fair to point out that they don't have the culture of now that associates today are dealing with. And yes, the work has always been stressful, but you know, research was expected to take weeks back then, not, you know, minutes at this point. Letters weren't email or expected to be responded to in the same day. So the now is what is so stressful. So if that's the case, how can we effectively educate these senior lawyers about that difference in now, that their experience of being a young associate is not what it is now, without it coming across as kind of a whining, or my boss would say whinging, of, you know, this generation? How do we effectively explain that?
You know, I mean, these are cultural shifts. These are cultural shifts, both, I mean, broadly speaking, but also within workplaces. And I'm sure that some law firms are doing this a lot better than others. And so one way is to, if there are examples of law firms that are doing this more effectively, kind of use them as champions to educate other law firms. That would be one suggestion. You know, another suggestion is to just internally within a firm is to really have a kind of almost a focus group of sharing of how some of, you know, how people are experiencing day to day now, to really put some names and faces and experiences and discuss how that is different than how it used to be, and what what those experiences are. I mean, these are just strategies. And so it's sort of, what I'm suggesting is more maybe having some group work meetings to discuss and share the experiences of how work is now, and also to learn about best practices from other firms. And that coupled with training of the leaders, and the training of the leaders on the importance of work-life support.
Thank you for that. We're coming close to time, but before that, I don't have more questions in chat, but I do want to encourage anyone who has anything else they want to ask to just take themselves off mute and ask them. And of course, reach out to you after the session if they wish. With that, I just want to say thank you so much for your time today. Lots of good stuff in there, and we appreciate your time. And
Thank
we
you.
hope to see everybody on sessions throughout the rest of the week.
Thank you so much. And this is so important, and I appreciate having the opportunity to share. And I will open it up if there are any other questions, briefly before we have to close down.
I have a question if nobody else does.
Mm-hmm.
If you're being supportive of one employee who's going through a little bit of a harder time, and so that might seem like you are relaxing your standards a little for this one person, how do you deal with how that affects the rest of the team who is still not going through a hard time, without like bringing down morale overall, to allow this other person to have a minute to take their breath and get what they need?
Right. That's a great question. And that also goes back to, it's a culture change in a sense. And at first it may be hard. It may be it may be a bit tenuous. But once the culture, once there is more embracement of why this is so important for supporting work-life issues overall, people start to understand, okay, you know what, it's their turn. It's their turn right now. Other people, it's not just all about, how it affects me, but we work as a team, we work together, we work as a firm, and sometimes at different times, different people are needing support. And so it is part of a larger culture shift, which really has to be made around well-being and the importance of well-being, and that we're not all doing great at the same time, and we're also not all doing poorly at the same time. And it's that understanding and it also is being careful that when somebody is being supported, that too much isn't falling on another person. And so that has to be managed correctly. I hope that helps.
Well, I just want to point out what Anne has shared in the chat, that the Thursday's webinar talks about structuring these team conversations. So this may be where we can continue to explore this.
Yes.
So thank you again, and thank you everyone for joining, and hope to see you at seminars for the rest of the week.
Great. Thank you.